Hello, my name is Dr. Singh. I am a private practice owner here at Family Veterinary Care of Oakdale. Join us on this educational series where I get to educate you, the pet parent, and also our veterinary professionals on all things animal health and industry-related topics.
So Pyometra is a condition that dogs get. Usually it's female intact dogs that are older, and that typically happens about a month or two after they're going out of their heat cycle. Pyometra is a condition that can make dogs extremely sick. There's two different types of pyometras that we see in practice. One is a open pyometra and the other one is a closed pyometra. Open pyometra means that we're seeing this yellow pus-like discharge actually coming out of the dog. A lot of times owners will come in and say, Dr. Singh, my dog is having some yellowish pink discharge coming from where they pee from, and so that's the open pyometra. And the second one is a closed pyometra, which is a condition where you don't see anything at all. Dogs usually present, or sometimes cats as well, they're usually presenting with just not feeling well, not eating, not drinking, lethargy. They might just be laying around. Vomiting is another big one that we see. And typically, we always think about, okay, is this patient a spayed female or are they intact, meaning that have not been spayed? So the clinical signs classic would be sometimes discharge from the vulva, sometimes not eating, lethargic. Those are the big signs that we see. There's a few different ways for us to diagnose pyometra. Number one way, when a patient comes in, the history, right? History is probably the most important part of us trying to making a successful diagnosis of what's going on. So history would be vomiting, lethargy, not eating, sometimes discharge coming from the area where we urinate from, or the patients urinate from, and then the next thing would be, we would probably do some lab work. We're interested in seeing, okay, are we seeing high white blood cell count? That's a big one. Are we seeing any other abnormalities in any of the other organs? Another way to diagnose pyometra would be doing an abdominal ultrasound, right? If we do an abdominal ultrasound and we see a large uterus which has lots of fluid in it, that's another huge indicator that this is pyometra. And sometimes doing radiographs, x-rays, could be quite helpful as well. And then when we're diagnosing pyometra, it's not one or the other, it's usually a combination of the history, along with we're putting pieces like blood work, ultrasound, or x-rays, and if they all kind of point towards pyometra, then that's kind of how we make that diagnosis and make our treatment recommendations after. The best treatment for pyometra is surgery, right? So if a patient comes in and they're not doing well, they either have closed or open pyometra, the best way to get rid of the pyometra is to go in surgically and remove the uterus and the ovaries, to then very quickly remove the presence of the bacteria and all the white blood cells that have accumulated in the uterus to fight the bacteria out of there as soon as possible. That would be the gold standard. Now, if that was not an option for some of us, then the next option that can be considered is fairly strong antibiotics. We strongly recommend seeing your veterinarian as soon as possible when you're suspecting that your pup's not doing well, because we need to do the right diagnostics to be able to figure out if this is pyometra. Surgery is always gold standard, is the first thing that should be done right away, but then also, and then not only if surgery can't be done that day, let's say we have to wait a day or two, starting them with antibiotics as soon as possible is the key. But this is a very serious condition that patients can get very sick very quickly from. We always believe in prevention is certainly key over treatment, right? We want to be proactive than reactive. And the key to do that is having our patients, our dogs and cats, both spayed. The goal is to get them spayed closer to about a year of age, because longer they go, more heat cycles they have, their chance of getting pyometra goes higher and higher. Unfortunately, not only we see pyometra in older dogs, we also see it in young dogs and cats as well. So really for us, we recommend having dogs and cats spayed about 9 to 12 months of age. If they're a little bit a larger breed dog, we might want to wait closer to 1.5 to 2 years of age. But usually you want to try to get that done as soon as their bone growth and musculature growth has completed. So that's the biggest thing. And the other thing that a lot of us don't know is patients that are intact, females, dogs and cats, if they're not spayed, their chance of developing mammary tumors, which are often cancerous, also gets much higher later in life. So getting a female dog and cat spayed at a much younger age is certainly the best thing for them.